All right. Well, good evening, everyone. My name is Vivian Dubard, and I'm going to be your host for tonight's event, Healthy Heart Matters, brought to you by the Columbia branch of the NAACP. Before we get started, we want to take a moment to have a moment of silence for all of our 500,000 brothers and sisters who's lost their life to COVID. So we can go ahead and have a moment of silence. All right. May God bless their souls and bless their families so they are left behind. Again, I'd like to welcome you all to Heart Healthy Matters as we celebrate Awareness Month. We felt the importance to discuss not only the impact of heart disease on the African American community, but we wanted to emphasize the impact it has on the African American woman. Of course, our panel tonight of healthcare professionals are not only going to just talk about how the various aspects of our lives are affect our heart health, but we'll also learn about different ways that we can keep our heart healthy. Now, before we get started, I want to go over a few housekeeping rules. Of course, please keep your microphones muted, and you can all type your questions either in the chat room if you're on Zoom or in the comment section on Facebook Live. Now, I want to go ahead and introduce our moderator for the evening, Dr. Macy Smith. Dr. Macy Smith is a licensed social worker, a fellow social worker, and a gerontologist with more than 2 decades of experience working with aging and vulnerable populations and their families and caregivers. Of course, she conducts research, develops programs, conducts program evaluations, and facilitates professional development training in the areas of healthcare management, family caregiving, Alzheimer's, dementia, and cognitive impairments. Dr. Smith is the CEO of Diversified Training Consultants Group, a geriatric care management group that promotes quality education and training for health and human services practitioners and families and caregivers. Of course, she's the author of A Dementia Caregiver's Guide to Care, a guidebook of frequently asked questions that will provide practical guidance throughout the caregiving journey, which we know can be quite difficult at times. Dr. Smith has published several peer reviewed journals and newspaper articles geared towards strengthening intergenerational family systems. And of course, her most recent accolade is that she won the Golden Pen by the Post and Courier newspaper for her letter to the editor urging state leaders to reopen nursing homes to families and caregivers to provide emotional support to seniors during the pandemic. Ladies and gentlemen, I'd like for y'all to introduce you to Dr. Macy Smith.
Thank you so much, Vivian, for the lovely introduction. And thank you all for being here for this very important discussion. Heart health matters. We have a panel of great experts that's going to bring you information that, you just can't get anywhere. You should be able to get it anywhere, but you just can't. And so I'm thankful to the NAACP, the Columbia chapter, for bringing this panel to all of you. So I want to go ahead and introduce our panelists. And we'll hear from them, the presentation at first from Dr. Williams and also Dr. Short. Then we'll hear from our fitness advisor, Cheryl Davis, and then we'll also hear from Judy Etheridge, who is a nutritionist. Dr. Lisa Williams. Dr. Williams is the health chair of the South Carolina State Conference, NAACP. She is a 29-year veteran of the nursing profession. She holds a master's degree in nursing. She's also completed her doctoral education at the University of South Carolina. She has worked, taught, and volunteered in all aspects of primary health care, clinical nursing, higher education, public health, nursing leadership and mentorship, tutoring, consulting, and entrepreneurship. Dr. Williams is an Amazon best-selling author and a warrior for causes in the Black community and the state of South Carolina at large. She is most passionate about increasing access and equality and equity to healthcare across both the state and also the nation. Welcome, Dr. Williams. Next, we have Dr. Tammy Short. Dr. Short is a member of the Health Committee for the South Carolina State Conference, NAACP. She is a family nurse practitioner with over 26 years of experience in the healthcare sector. Having worked in numerous healthcare centers across the country, Dr. Short exhibits highly skilled versatility in pharmaceutics, subacute rehabilitation, nurse leadership, trauma, health informatics consulting, church health promotion events, and she's also a traveling nurse. She holds a BS in biology and nursing, a master's degree in nursing, and a doctorate in nursing practice. Dr. Short's passion for nursing is underlined by her care for underserved citizens, veterans, and communities in need of sufficient health care. We also have on the panel Cheryl Davis. Cheryl is a fitness advisor and the owner of Rockin' Kitchen and Rockin' Fitness. She educates people on adopting and living a healthy lifestyle. She focuses on being healthy and not being skinny. Now that's a word. Last but certainly not least, we have Judy Etheridge, AKA Chef J. She is the owner of Celebrity Fit Lifestyle. She is a certified fitness trainer and recipient of the Cooking for People with Illness, Culinary Nutrition, and vegan baking certificates from the Natural Gourmet Institute in New York City. For many years, she has served clients as a fitness trainer and health supportive chef. With her extensive educational training, she can recommend a fitness plan and offer nutritious and delicious meals that are tailored to fit your needs and goals. Chef Jay's goal is to make it easier to spread the wealth of a happy and healthy lifestyle. Welcome, Judy. Thank you
Thank you.
all for our panelists. We appreciate you being here. So we'll go ahead and get started with our docs, Dr. Short and also Dr. Williams. They're going to present a presentation to us about heart health.
Thank you for that beautiful introduction, Macy. I'm going to share my screen with you because we prepared a PowerPoint so you guys can follow along fairly easy with us and not just sit here and listen to us talk. Okay, so Mr. Harvey, I can't share my screen. Okay.
Should be.
Okay, thank you.
Can you share it? Awesome.
Can you guys see it?
Yes.
Okay. So basically, I'm going to do this. I don't know if you guys can see what I just did, but I kind of minimized stuff so that I can see my screen too. We're going to start this, and Dr. Short and I are going to tag team this together because there are just certain pieces of this that one of us may know a little more about or have more information about than the other. And so what I'm going to do is I'm going to start it out, and then Dr. Short come right behind me. So let's talk about women and heart health with the emphasis on African-American women, because it's probably a lot you guys don't know. And let me start out by sharing this with you. Okay, hold on. There we go. Did you know that cardiovascular disease was the leading cause of disease for women? Also, did you know that every year 267,000 women die from what's called a myocardial infarction, what we call a heart attack? And also 9,000 women who have a heart attack are younger than 45 years old. There's a lot of this stuff people don't know about it, but it's information that we need to know. Since 1984, the number of women whose deaths were related to a heart attack has took around men, and it continues to rise. And despite these facts, our health risks are still overlooked. Research and evidence say that that women's health is delayed, in identifying what our symptoms are. Our care is delayed, specifically in recognizing what's a MI or what's a heart attack in a woman. There's a lot of gender disparities, but there's also, as we know, a lot of racial and ethnic disparities. Cardiovascular disease, again, is the leading cause of death in women, which in turn increases our mortality rate. What we need to do is we need to highlight that women have what's called a non-common presentation or atypical, And so we need to know how to get an earlier diagnosis and improve the risk.
Okay, so I know many of you watched Fred Sanford, Sanford and Son back in the day, where Fred would put his hand on his chest and say, "I'm coming, Elizabeth." Well, in this situation with women, we present a little differently. So that's probably why there's often a delay in treatment. If a cardiac event is recognized early, it can actually reduce the mortality rate. Only about half of women with the heart attack present with chest pains. In fact, women are more likely to present with atypical symptoms like feeling tired, sleep disturbance, shortness of breath, back pain, upper abdominal pain, or somebody may actually think they have acid reflux and it's actually their heart showing that there's some abnormalities. You may even notice nausea or without vomiting rather than simply presenting with chest pain. Compounding the problem for women is that women may not believe they're vulnerable to a heart attack and may be less likely to identify their symptoms and signs of that of a heart attack. Women experience a greater diversity of MI symptoms compared to men, according to a comparative study of 82 men and women. Study finding also indicated that a non-chest pain symptoms occur frequently in women and may be falsely identified as musculoskeletal, meaning like maybe back pain or shoulder pain or neck pain, gastrointestinal or emotional in origin, and deemed inconsistent with cardiac symptoms. Common heart attack symptoms in women, such as nausea, are less likely to be identified because most women expect that they'll have severe chest pain when having a heart attack. The average delay for treatment in women is 1 hour longer than that of men, which is clinically significant to your outcome. Also, women who experience signs and symptoms of MI tend to delay seeking medical treatment longer than men do. This plus misdiagnosis may compound the poor outcome. A promising finding is that after being educated about heart attack symptoms, women are more likely to be able to identify atypical heart symptoms.
So let's back up and go back to something Dr. Short said. She talked about delaying treatment and the common reasons for delaying treatment, because recognizing and treating a heart attack within 1 hour is what she told us. It's going to be paramount to saving women's lives. Often these symptoms are misinterpreted and it can be deadly for women. One study that I read also showed that women who didn't have chest pain delayed seeking treatment longer than those who did have chest pain. So we're still uneducated thinking that it's going to be chest pain that says that we're having a heart attack. So what did this translate into? This translated into women being delayed more as usual and more women having poor outcomes. Also, what they don't know is when they compared how women are managed compared to how men are managed, well, guess what? Men are managed much more aggressively when they have a heart attack. Women are not, because we say stuff like, oh, it's nothing. You know, we tend to, especially African-American women, we tend to keep going and we tend to think it's nothing. So what we've learned in the past 2 decades is that deaths from heart disease have declined among men. But guess who they're not declining among? They're not declining among women. We need to assess the heart attack risk in women and also find the challenges and the noteworthy differences and why they exist and the outcomes and risk factors when it comes to men and women compared to each other.
So the question on the floor now is, what do we do as healthcare providers? And the answer to that is we need to be more vigilant. We need to do more screening. And most importantly, educate our colleagues and families. Risk factor screenings are assessments for common, modifiable. And when I say modifiable, these are things that we can actually change. coronary heart disease factors is done for most women in the years before their first cardiac event. However, screening without effective treatment of abnormal results is of no proven value. The compound problem of misperceptions of risk is women and frequently atypical symptoms presenting, leading to women having a less aggressive pattern of care and a delay in diagnosis and treatment. Because detailed evaluation of chest pain characteristics in women fail to yield typical features, as I stated earlier, either alone or in combination. Healthcare providers face a clinical challenge. It is our goal to stay vigilant and have a high index of clinical suspicion for heart attacks in adult female patients in general. However, based on the care that is reviewed by African American women, our care is much more dire. We must heighten these future nurses' awareness regarding women and heart attack within the African American community. Ourselves being the priority. In addition to educating our colleagues, healthcare providers who care for patients with coronary artery disease are in a unique position to educate patients and family about the symptoms of heart attacks. Educating our own is vital in promoting early diagnosis, which ultimately decreases the mortality risk for an acute event. Teaching and later reinforcing essential information regarding MI in women is critical. A woman who can recognize the symptoms of a heart attack and quickly seek medical attention instead of attributing her symptoms to a benign cause like, oh, I have acid reflux, oh, my neck is just hurting. You could actually avoid disabling or of life-ending consequences.
So once a year, we celebrate, the American Heart Association celebrates the Red Dress campaign, and they tell us to get out there. And this is information regarding heart disease in women, and it's sponsored by them. This campaign offers sound resources for helping women to take control of their heart health. It provides screening opportunities for women, such as the Go Red Heart Checkup for women, to assess risk factors for heart disease. The campaign also encourages women to communicate with their healthcare provider and to schedule regular checkups to promote their health. So here I picked 7 because 7 is the number of completion in the Bible. And so we got 7 tips for a healthy heart. So we're going to start with number 1. Stay active. Exercise at least 3 times per week for 30 minutes. Getting your heart rate up through physical activity will limit your risk of cardiovascular disease by 28%. If you have a busy routine, take the stairs instead of taking the elevator. Park a little further away from the grocery store. Take a break from work and do a brisk walk around for about an hour. If you have a wearable monitor, make sure you go at least 10,000 steps a day. It's just little things that we can do to make it better. If you're a smoker, quit smoking. When people quit smoking, they cut their cardiovascular disease risk by 71%. Know your numbers. Now, some of these numbers we might not all be familiar with, but 6 out of 10 women do not know their numbers. Here's your numbers. Your blood pressure, what is it? Your blood sugar, what is it? What's your cholesterol level? What is your body mass index? Okay? And know that when you know your risk factors, your cardiovascular risk can drop by 32%. Avoid alcohol. Now, I know everybody needs that glass of wine every now and then, but drinking alcoholic beverages can lead to high blood pressure, increased calorie intake, and increased cardiovascular problems like arrhythmias and heart failure. So I'm saying, I'm not saying you can't have a glass of wine. What I'm saying is overdoing it can lead to issues. Eat heart healthy. While there are many diets claiming to be healthy, make sure you can visualize at least 3 colors on your plate. Also, if you are a meat eater, then sometimes you can replace the red meat with the white meat and avoid processed foods. Processed foods got all kinds of preservatives in them and things we don't even know about, and they can cause issues. Number 6 is limit your static activity. What that means is get up off the couch, move around. I know that's hard right now during this time of COVID with everything we're going through, but try to move around and get around. Limit the amount of TV you watch. If you go into the American Heart Association website, It tells you too much sedentary time increases your risk of cardiac disease. And for number 7, be your own advocate. Encourage other women too. Encourage your colleagues, other Black women, go to their doctor's appointments. We have more than just heart disease going against us, but learning today that it is the #1 killer, guys, please know it is the #1 killer. It's killing us. And it didn't separate us out into African American, although we do get subpar healthcare. That's a known. So imagine how many of us are dying if this is a thing for women altogether. At the bottom of this slide, there is a link, and I'll share that with you guys if any of y'all want it later. It's really fun. It's a calculator. When you click on that link, what it does is it takes you to a website that asks you questions. And what it does a risk assessment. And it gives you what your heart attack risk assessment is. So it's really a kind of fun thing to do. But most of all things, avoid stress.
Believe it or not, everyone, stress can be detrimental to your body. Your stress level coupled with how you react to stress can cause a wide variety of health problems. Stress is characterized by over-engagement. I know you all would probably remember from psychology or biology where you talked about your fight or flight syndrome. So that's pretty much set up like when you're scared or when you're frightened, your body automatically reacts. Well, that shouldn't be your constant state. It's something that's acute and you're done with it, but just living in constant stress can definitely impact your heart. Also, emotions are overreactive. That can impact your stress levels. It produces urgency and hyperactivity. It can lead to unhealthy behaviors, smoking, alcohol, and illicit drug use, physical inactivity, over or under eating. And what are the effects of stress on your heart? It can cause you to actually have high blood pressure. It may cause you to sleep too much or not get enough rest. You can get migraines, back pain, asthma. Then there's the irritable bowel syndrome. And that's typically like when you're having like alternating constipation and diarrhea, in addition to stomach pains, nausea, and vomiting. Also, decreased energy level, irritability, feeling cranky. Stress can just kind of do all of that to you. It leads to anxiety and depression, and it can also cause chest pains, heart palpitations, shortness of breath, and can contribute to heart disease, which we discussed is a leading killer in America.
So what can we do? What can I do? Well, first of all, we got to have good management. We got to control our stress. Control of stress fosters good overall health. We got to identify what pushes our buttons, what causes us to be stressed out, and use effective and healthy coping skills. Number one, something many of us fail to do because we're all just super women and we're powerful, but we need to be okay with asking for help. We need to be okay with talking to others about our difficulties and seeking support in those that we can trust. Sometimes we just need to take a respite or a rest and retreat. One thing I love to do is I download calming apps, I download meditation apps, and I deep breathe and I release. And then sometimes we just need to regroup. Hot bath with Epsom salt, we can get a massage, and then we can make whatever personal changes we choose to make in ourselves. We can regenerate, eat a healthy diet and watch our weight, exercise, maintain a positive attitude, avoid smoking again, and avoid drinking too much coffee. Coffee has been known to have some good qualities to it, but too much coffee can cause tremors and anxiety and make people feel on edge. And you also want to find purpose and meaning in activities at work, in your home, and in your community. But most of all, use effective and healthy coping skills. Manage your stressors, because if you don't manage them, I promise you they will manage you. So guys, what are we gonna do? We're gonna relax, relate, and release. We're gonna keep stress from hurting our hearts. We're gonna keep stress from running our lives. We know that we have challenges in our health as African American women, and we're going to face them head on. Thank you guys. And any questions?
Thank
Okay.
you, Dr. Williams and Dr. Short. That was a very succinct presentation, and it actually addressed a lot of questions that I had about just what is heart health, why does it matter, why is it important, what are some of the things we need to do, what are some of the things we need to look out for. I like that you mentioned know your numbers.
Mm-hmm.
Now, you know, we ask questions. I'm glad I'm the moderator because I got a whole bunch of personal questions I want to ask.
Mm-hmm.
Know your numbers. That's so vitally important because everybody's numbers may not be the same, but we as you stated, we do know that blood pressure is a contributing factor if it's too high. How
Mhm.
high is too high? I've always known 120 over 80, 120 over 80. I'm not rolling with 120 over 80. I don't think I ever rolled with 120 over 80, but the doctor never said anything. The doctor never said that it was an issue. But, you know, as I'm educating my family caregivers and talking to them about taking a break, taking care of themselves because they're stressing out, they're going to pass away before the person with a chronic illness who has Alzheimer's because they're not managing their stress. They're not managing their blood pressure and their levels. Well, Dr. Macy, what should our levels be? Well, I ain't that type of doctor. You got to ask your real doctor. But is it 120 over 80? Is that what your blood pressure should be? Is that what you should aim for? And does age play a part in that at all?
I'll speak on that first, and then Dr. Short, you can come on behind me and add anything to that. According to what we have in medicine is we have guidelines that we go by. And according to the guidelines that we follow what's called the JNC. And the JNC tells us, what are we on now, Tammy? 8?
I think it's 8.
Yeah, we're on JNC 8 now. It changes over the years. And the JNC 8 tells us anything less than 120, the top number is called systolic. 120 or less is the systolic, but the bottom number is the diastolic. And so you want it between, I want to say 80, less than 89. Am I right, Tammy?
That's correct.
Less than 89. So basically that's what, now it changes a lot, but also there's other factors that factor in. Sometimes depending on what the underlying condition is, or if they have other comorbidities, then your goal may not be so perfect. The goal blood pressure may change if it's, say, a severe diabetic or somebody who has kidney failure. So that may move the goalpost. You know, someone with kidney failure or severe diabetic, they may say your goal is 130 over something. So it kind of, for normal everyday people, yes, you want everybody's blood pressure to be 120 over 80 or less. But sometimes, depending on what underlying other disease process they may have, they may move the goalpost for them a little bit.
Yes, you're right, Dr. Williams. It's JNC 8. And no matter who you are, if you're 18, if you're 100, you need to stay under 89, that bottom number, that's your diastolic. And then if you're over 60, you can be up to 150, but we like for you to be less than 139 on the top and less than 90 on the bottom.
So I'm good. That's why I never got any treatment. So I know that you both have some prior commitments and you got to get out of here, but I do want to ask you a question from the thread. You mentioned in your presentation that women, and I have the same question too, when you stated women are not treated as aggressively as men when they present with heart, palpitations or heart concerns or chest pains. Why is that? Does race play a part in that? Angry Black women, we blow things out of proportion. Do you feel that has anything to do with it? Is that a part of the discriminatory factor that goes into play with our healthcare?
I really think it's a part of systemic racism that goes on, especially with African American women. I mean, I'm a researcher and I look through a lot of charts and files and stuff. And even when I'm just seeing a patient, probably not my patient, I'm seeing for somebody else, or seeing for a different reason. I'm a reviewer of charts. And one thing I will share with you is that I noticed, like, for instance, I'm gonna give an example. I was reviewing a chart of a woman who was complaining of something else, but I got to her history where she had a baby. She was an African-American woman. And I noticed that there's standards of care that we have to do. Every time someone comes in and they're just seen for a routine visit, we have to get a blood pressure. That's a standard of care. But this, during her time, she was African-American. We have a high mortality rate with pregnant women, you know, and babies. 4 times they did not get her blood pressure on visits, a standard requirement. And so were they purposefully being discriminatory against her? No, that's because we just don't get the care that everyone else gets. And so when you ask me about it from a heart disease from a heart attack standpoint, they have so many other things to blame on why we're feeling those. Oh, maybe she's going through menopause, or maybe it's her thyroid. You know, I mean, even like depression is a part of stress, and it can cause heart disease. But depression is often overlooked, and a woman is misdiagnosed. She's diagnosed with depression when it's a thyroid problem causing the depression. And thyroid problems, guess what they do? They hurt our hearts. So now her heart is being hurt, and they've not diagnosed her correctly. So they blame it on so many other things that were often misdiagnosed. They don't do what they're supposed to do and look totally into it to see, why is this woman really experiencing this? I mean, so many women in their 40s are just pushed into menopause. You know, a lot of women in their 40s, their uterus is not retired yet. It's still working. And so, you know, seriously, I mean, mine retired, but, you know, most women are not retired. So you got to treat women as if they're childbearing age until they're, believe it or not, 60 years old.
Well, that goes to your presentation. It says you have to be your own advocate. And I tell people all the time, doctors and medical practitioners are practicing medicine. You have to speak up. You have to give them ideas. You have to give them recommendations. You got to let them know what else it could possibly be. I don't like to ever blame it on one person, because it's a collective. It's a holistic approach to care. So that jumped out at me when you all talked about that whole thing between women and men. But it is a reality. Are there any screening tools? I'm a very practical person, and I like for people to have the information, but also access to tools that they can actually, if they're not presenting with any symptoms, they have atypical symptoms. Are there any screening tools outside of the tool that you mentioned in your presentation, to whereas they can determine if they're at higher risk or not?
Yeah, there's a lot of tools out there, especially digital tools now in this digital age. You can actually go on and calculate your BMI now online. You can now cholesterol levels, that's a lab that has to be drawn, of course. But you can actually, you know, and I know that the people who are into nutrition here is that, you know, recent studies have even showed that we don't have a whole lot of control over our cholesterol areas. So because recent studies showed that a lot of it is genetic, but what we can do is we cannot compound the problem. But there's a lot of screening tools out there. The depression screening tools, there's one called a PHQ-9, but those are used in the in the professional setting. So, you know, one thing that I love though about being a nurse practitioner is we're very collaborative. So we work with social workers and we work with therapists and psychologists, because I may get someone in who I have a treatment failure, or they're not responding to medication and it's because of depression or something. And then I could easily do a referral. So, you know, we have like collaboration as a tool, believe it or not. But most tools are used within the profession, but there's a lot of digital things out there now that you could go to. I know for a fact, especially with, you know, if someone quit smoking, there's an app that they can download, and it tells them for each day they've quit what their lung health is now. It gets better and better what their heart health is now, how much nicotine is in their system. So, and it's kind of like a motivator, you know, so there's a lot of tools out there.
Thank you so much for mentioning that and providing that information. I know you ladies got to get out of here, and I really appreciate your presentation and sticking around for any questions and answers. I want to tell the audience that are on Facebook, If you have any questions, please drop them in the comment section. Our doctors are going to have to get out of here in a few minutes, but you can still drop the question in, and I'm sure you guys will go back and check the feed and can provide any type of information, especially those screening tools, not the diagnostic tools, but the screening tools that they can use themselves at their leisure to manage their risks. Thank you, ladies, so much. I really appreciate you participating on the panel.
Okay, thank you for having us. And Mr. Beach, did you still want me to say anything, or if anybody had any questions about updates on COVID?
That would be great. Yeah.
Yes, please.
Okay. So I'm just going to update y'all on the last few things that we as an organization have been working on. We're really looking at access to the vaccine and how some things in the media have been going on. I don't know if many of you saw the Sunday paper, but it was a hoot. And you know, a lot of what's going on is there are a lot of people in our community, and by our community, I mean the Black community, who definitely want access to this vaccine, but they've been having problems. My own mother herself, she got her first shot because I had to go all the way to rural South Carolina, bring her up here, which is almost a 2-hour drive, to get her shot here because she couldn't get an appointment for her first vaccination. And since she's had that one, which was in January, her appointment has been canceled 5 times. Oh. That's not unique. I'm not unique. My mother's not unique. That is happening. There are African Americans out there who want the vaccination. They want access to the vaccination, but they're not getting it. We are working on that right now, y'all. We really are. But the one thing, if I could encourage all of you guys to do, is educate people that on this vaccination. Teach them that Tamesia Corbett was the one who'd been working with mRNA vaccine for years before this even came out. So they took her research and her stuff and they made these vaccinations. You know, one of the things that I recently said is the reason why so many African Americans distrust the medical field, and rightfully so, is because no effort has been made to repair it. No effort has been made. So you know what? At some point, I mean, it's like a friendship. At some point, if someone doesn't want to repair something with you, then we got to do the repairing ourselves. We can't worry about other people fixing things for us. We have to fix it for us. One way is to support one another, educate one another, and anyone you come across who has doubts about the vaccination, educate them, because I'm going to tell you this, and I'm just going to compare the 3 and then I'm going to get off of here. At the end of the day, if I could get one shot and get 85% efficacy all day long, bro, I'm telling you right now, all day long. So while our people are saying, well, I don't want the Johnson & Johnson, look, it doesn't matter which one you get. You know what COVID can do. But the only thing we know about this vaccine is that it's saving lives. Which side of the fence you want to be on? So we got Pfizer, which has all the logistical cold stuff, 95%, 2 shots. Moderna has a little less logistical cold stuff, but still has it, 95%, 2 shots. But we got this J&J coming out. So if you were skeptical or people are skeptical about getting the shot, let them know. It's a one and done, and you got 85% coverage. That's better than nothing. That's right. That's better than having COVID.
I appreciate you saying that and putting it out there just like that.
Just like
appreciate
that.
You so much. Thank you so much for being here and
Thank
for
y'all.
sharing such great information. Got some comments on Facebook said it's an outstanding conversation. So you're doing the work. I appreciate that. Thank you all so much. So a part of the conversation, we're talking about preventative measures. Perry?
Yes, I have a question before she leaves.
Okay.
All right. I've heard, I recently survived a battle with COVID, and I'm still having a lot of problems, fatigue, brain fog, you know, things like that. But I was told that if I've had COVID, that I even on the 2 shots, that if I had COVID, I could take the 1 and that's good enough. Is that true?
Well, I can't say that because it's all about science, and everybody's bodies respond to vaccination differently. My immune system is not going to respond to something like yours. What I will say, you've already had COVID. First of all, the symptoms that you're experiencing are called long hauler symptoms, okay? And we don't even know enough. This is what medicine fails to do, what I'm doing right now. We don't even know enough about the science of this brand new disease to even explain to you any more about long hauler than you already know, okay? But what I can tell you is this is how vaccination works. When they vaccinate you, and this goes for all of them, even with that vaccination being in you, it's not the vaccination that builds up the immunity. Your body does it. So if you even get that one shot, within 49 days, your body has built up more immunity than that one shot would have given you. So that's why, what it was probably with Pfizer, and this is just a guess, they realized that 2 shots speeded it up more, but your body takes over and does the rest. So I hope I answered your question, because basically, whether you get 2 shots or 1 shot, your body is going to take over and build that up anyway. But because you've had COVID, they know that having COVID gives you only about 30% protection. Okay. So get the shot to get the rest of it. That's what I would do.
Yes, ma'am.
That was an excellent question and a superb answer. Thank you so much. So in the presentation from Dr. Williams and Dr. Short, they talked about preventative measures, Cheryl. They talked about exercising, staying active. Was it 30 minutes a day? Was it at least 5 days a week, or was it every day? My mind goes and says, let me see how much I do, and I'm gonna make it fit me like the Bible. You know what I mean? But that is a given. Lifestyle changes and maintaining a healthy lifestyle will reduce your risk of having any type of heart conditions, reducing your risk of having heart disease. I know that you have a personal story. You have a personal connection. You have a personal passion for, I won't say exercise, I'm gonna say staying active. You've seen me in action, right? And I don't like it. I do it because I know and I understand the health benefits of it, but I don't like it. How important is staying healthy in terms of overall health and especially heart health? And for the people who don't like to work out or who don't like to exercise, how do you motivate them with your story and your experience?
I motivate people by just basically telling them my story. And also, there's an alternative to everything. Just like with eating, there's an alternative to everything. So I post a lot of videos and people be like, oh, I got to jump into that. No, it's like everybody's at different levels. So I go according to your level. So if you're a beginner or a kindergarten, how some people say, you'll get the kindergarten or beginner workout. Because everybody levels is different and you just build on top of that. So that's what I teach over here. And 30 minutes is really all you need. A lot of people are in the gym for hours. It really doesn't take that. It really doesn't.
And some people are very obsessed with it. They love it. They love working out. How has exercise and staying active changed your life in terms of health?
For me personally, I actually have a chronic illness called Crohn's disease. And so I was a meat eater for several years. I've been overweight all of my life. And so I was at a point in my life where I was tired of being sick and tired. And I tried everything that was out there because, I wanted to do the quick fix because I wanted to lose 50 pounds like 2 days ago. And it wasn't happening for me. I tried the different diets. I tried the pills. I tried it all, and it just wasn't working for me. And so if I didn't see the results that I wanted to see in a week or two, because a lot of times we hop on the scale and the scale is not your friend. And I always educate people, take your measurements. 1 year I lost 15 pounds and that was very discouraging, but I kept going, but I wasn't taking my measurements. Everybody's like, oh, you look like you lost weight. But I was so focused mentally on the scale. I wasn't looking at anything else that was going on. So basically I educate people like, stay off the scale because it's really not your best friend at all. And with my chronic illness, I decided that it was time for me to make a change. I wanted to see what I can do if I didn't give up. Because a lot of times if we don't see the results that we see within 2 weeks, because that's people time frame in their mind, well, I need to lose 100 pounds in 2 months. That's a lot of people come to me. I want to lose 50 pounds in 1 month. They want dramatic results and do dramatic things, but a lot of times it's not realistic. You need to have realistic goals. And I tell people that you need to have realistic goals. So here I always educate write down your goals as you go, realistic goals, 2 pounds per week, changing your the way that you eat. Now, I used to eat meat, and when I started losing my weight, I did something dramatic. I went vegetarian, cold turkey. That's me personally, and I've been vegetarian over 7 years. Then I went back to eating fish because my doctor told me that I needed to have more protein. And of course, I was like, I was going back and forth, and I wasn't sure if I wanted to do that. And I went ahead, started eating fish. It was okay. And then now I decided to go back. I'm totally vegan right now. Been vegan, plant-based for 4 weeks. By me changing my eating habits from being going to a vegetarian, my Crohn's disease is under control. I don't have any issues with my bowel movements because that's something that a lot of people don't talk about. It's their bowel movements because people have the IBS, especially in our Black community. They have chronic illnesses. And that's something that people don't talk about. And I do talk about that over here as well. And by me changing my eating habits, I changed. I started losing weight, and I started seeing the results that I wanted to see. And I just kept going. And a lot of times when people start their journey, they don't see someone who looks like me as a personal trainer. Just because I might be a little bit heavier doesn't mean that I can't do what you can do. And I always show people that if I can do it, you can do it. It's really a mental thing. And we also focus on mental wellness as well, because when you're losing weight, your mental wellness is essential. And what I started incorporating here is yoga, just having a time to relax your mind and basically focus on the things that's important to you. It's like a type of a self-care, but also to help prepare you for the week. We've been doing that for the month of February for every Monday. And also try it before you buy it. And just a healthier, different things that's healthier. Vegan, since I'm doing vegan and someone else is doing vegan. So they're gonna try what I'm eating. I am kind of just forcing them just a little bit just to try something different. Once a week. And everybody that I trained joined the challenge of eating vegan for the month of February, not just meatless Monday and dairy-free Monday. And they are loving the results that they have seen so far. And also they feel lighter. They don't feel heavy, lethargic. Right. So they feel way different. Now, when March come around, because they was talking about Chick-fil-A sandwich and all that, which I'm like, do you, which is totally fine, but people are just wanting that taste. Right. And which is understandable, but they said they learn to find a balance. And I tell people you need to find a balance when you are on this lifestyle change, because that's what it is. It's not a diet, it's a lifestyle change. So if you used to be like me and eat a whole medium pizza in one setting, so instead of eating a whole pizza, eat two and keep it moving. It's about finding your balance and what works for you. What works for me may not work for you. So that's why I don't be like, well, you have to be vegan to lose weight, to be healthy, because there's unhealthy vegans. So it's like you have to find what works for you. And so I educate people and I show them that you can be healthy if you eat meat, beef, pork, whatever you do. You just have to be active. So as long as you're active, you should be fine.
And I love that. And I will say that you have had a hand in training me and my husband. And honey, she don't break. And we're looking like, I hope she go get some water or something, because I'm tired, but you have the motivation of a champion. And I applaud you for everything that you have accomplished. You do an excellent job. And I'm so thankful that you talked about nutrition and how you don't have to eat this and you don't have to eat that, and everybody's body is different. And Chef Jay is over there like shaking her head. So I know that you're spot on. But we always talk about with any type of chronic illness, and African Americans are typically at the top, are affected the most from all the top 10 chronic illnesses. And in every breath, we talk about lifestyle. We talk about staying active. We talk about nutrition, even down to the illness that you can't do nothing about, Alzheimer's disease. We know now that 30% of the dementias that we see can possibly be averted with staying active and eating, Chef Jay, a healthy meal or have a healthy meal plan, because I don't believe in dieting either. I absolutely do believe in balance. And I'll tell you, with Chef Jay's food, you don't even know that you're not eating meat. Like, she'll let you eat it and she'll say, Macy, you know that wasn't meat. That had got to be meat. Chef Jay, how do you do it? Your food, we all know you. You know, your food is healthy, your food is tasteful. So, I mean, why can't you lower your risk? If you can eat like Chef Jay and not really work out, but just, engage socially with Cheryl, we can handle this. Tell us a little bit about your meal preparation and things that we can do at home, especially when we go to the grocery store. How can we maintain a healthy diet? And does that mean that we can't have pork? Does that mean that we can't have beef?
Right. So I'm so glad. Thank you for having me, first of all, this evening. And that's one of the strategies that we go towards. We like for you to be well. And so in being well, that doesn't mean that you exclude anything. That means that what you talk about being balanced. We can enjoy all those different things, but I tell my clients all the time, you can't cheat a whole weekend. You can cheat to have a meal that you want to enjoy, but I think sometimes we get caught up in, it's so much in the marketplace that we kind of get sidetracked by wanting everything. We have to pick and choose and learn that balance, what you talk about, and learn what works for your body and doesn't do. Like, for instance, what Cheryl said, like vegan works for her, but it may not work for nobody else. I tried vegetarian. My face, I was awfully thin. My face broke out. My back broke out. So you have to pay attention to your body. And that's when we come and we educate you on, let's take out some things and then add one thing at a time after over a 3-week period to see what your body does. So I tell people, if you get gassy, if you get bloated, if you get gain weight, or you feel lethargic, that means that something in that meal didn't agree with your body. And so that's the way we like to approach it, by being individual and going by looking at those things that we are eating and the things that our body don't agree with.
I agree with that wholeheartedly, and I'm loving this conversation. We got the chapter president on the line, Miss Glover, too. And I'm excited about the conversation that we're having, because when Cheryl, I hope y'all don't think I'm crazy. When Cheryl talked about bowel movements, I am so particular about bowel movements.
Mhm.
And I'm gonna tell you why I say that, because the population I work with, the senior population, and also their caregivers, when you're constipated, your body is telling you, as you just said, Judy, it's telling you that something that you just took does not agree with your body. Beef does not agree with my body. And I love hamburgers, I love steak. But whenever I would eat it, you already know I would get constipated. So I love beef. And so since I don't believe in dieting, Vivian, I eat beef once a month. That's it. But because my mindset, and Cheryl, you talked about mental wellness. Chef Jay, you're talking about wellness. I'm saying to myself, I love beef. I want to eat beef, but I know it's not good for my health, heart health, overall health. So in order to have that balance, I say I'm going to eat it once a month. And guess what? I don't eat it once a month, because I've already taken that whole, a stretch without even eating it. I might eat it if I see it, especially late at night when you up watching the cooking channel and stuff. So how important is that, Judy, in terms of mental wellness, and how can we get our mind right to say, I'm gonna be vegetarian, or I am gonna go vegan. My husband is vegan and he does excellent. He did like you, sure. You train him a little bit more than you train me, and he just cut it out, and he is fine, like finer. And I'm just like, he was like, you should try it. I was like, I don't know, child, but I have tried the vegan burgers, and I seasoned it just like a real burger, Miss Glover. And you couldn't tell me I was not eating a hamburger, right? But it's all a mindset. But I had to watch the sodium intake in the vegan burgers, because it's a lot of sodium in there. So just that balance. What guidance do you have for us, Judy, in terms of calorie intake? What do we look for when we go, say, if we are switching over to a vegan diet and we're doing more vegetarian? Do we look out for the sodium? Because some things have more sodium than if it was beef.
Right. And so that's so interesting you said that, because when they start introducing different things that's supposed to be what they call vegan vegetarian, we got to also know there's process. And so when you're looking at the processed food, I like the fact that you said we have to look at the salt intake, especially for heart health. We have to look at the fat intake. And I tell people science is simple. If you're trying to lose weight, it's all about the numbers. What we said, know your numbers, know how many calories you need to maintain a healthy lifestyle, know what it takes for you to lose weight. We get so caught up in all these different things, but science is if you're trying to lose weight, eat less. We keep going through these things and the different avenues, all different kind of programs, and cost us a lot of money, but we just keep it simple. How much you take in, and you can do like the calculations on the like she was talking about on your telephone, put in your age, whether you're active, and they'll tell you how many calories you need to lose weight. But we get so caught up in on all the other things that make it difficult. It's not that difficult. And we have to figure out, like I said, what our body agree with. I have women that their skin may break out. When I see that, that makes me think that they either are not using the bathroom, like you said, which is I'm very funny about too. That's just something normal and natural. Because if you're not using the bathroom, where's it at? What is it causing? A lot of people, they lose their hair. That's some of the reasons why they skin break out, because some people are very sensitive to dairy. We're very sensitive to sugar. But I think culturally is where our bad diet and habits may have came from. Because, when we get together, we want to have all of these different foods. And there's nothing wrong with that. But, like we can't do it every day, but there's nothing wrong with that. I just want people to know that loving yourself, first of all, is the number one thing. And on my shirt, it says, you deserve to live well. We work so hard and we give so much of ourselves. But like Cheryl was saying, we just have to take time to just take a deep breath and love on ourselves some.
I love that. And I think that's a great way to end this panel discussion. A lot of times people are scared to have this conversation, but you all made it easy. You all made it digestible. You all made it understandable, and in a way that's very translational and transactional. I'm already going to make some changes because these are easy changes that we can do. So thank you all for sharing your story, sharing information, and just realistic ways to maintain heart health. Thank you. Thank you so much. Ms. Glover, we have our chapter president on the line for the Columbia branch of the NAACP. Now, how awesome was this panel tonight?
It was, can you hear me? Because I'm not sure. I got two things going on. Oh, great. It was very interesting because I suffer with SVT. Don't ask me to say the words because I cannot say that, but I can say the acronym SVT. And it's when your heart beats really fast. I'm going to be jovial right now. When I went to the doctor about it, and she was telling me what she could do 2 different ways, and one was to cut, one was to do something else. And I said, imagine me trying to be cute and you didn't get cut my throat or something. She said, okay, you'll be walking down that street and dropping dead. So what you gonna do? But I didn't have to get the cut. But it's very interesting because I work with youth and I speak to them all the time about what they're eating. And I'm in dialogue with the cafeteria always about, especially during this COVID period. I oversee the COVID building. So the feedings that they need to be a little different than from a regular student because of the different issues that they may be going, breathing, the eating, the overweight, not getting exercise like they need to get, that kind of stuff. So I can relate to the vegan, the veggies. I always talk about veggies. I always try to tell them, no, put the fat back in it and all of that while they're feeding those kids at the time. So it's very important what all of you have said. I did learn something as well, and I appreciate you taking the time. And I got to give kudos to the health committee and Mr. Harvey Beach, who is so persistent, y'all. I ain't gonna talk about him, but anyway, it's a very good thing. And I know that we will have you back on because our actual membership is not on here. So when we become live again or physical again, we would like to have all of you to partake in it. Also, if you're not a member of the NAACP branch, I'm going to give you a teaching lesson right now. It's not chapter, it's branch. Um, okay, so that's the difference. Please consider joining, because we do need your expertise there. And the NAACP is not all about marching and all of the above. This is the kind of things that we need to be doing to get the information out to people. In these forums, and you going out and saying, hey, I was on a forum last night with the NAACP branch and we discussed this, it's going to bring more people in, and people will know that we are working out here. And it doesn't always have to be physical that we do that. I'm going to take some of the information that I received. I was jotting notes. I'm also on another Zoom as well, but I want to give some of the information to my youth that I work with, because their heads, it's all about, I got time. I'm not old like you, Miss Glover, so we don't have to worry about that kind of stuff. But the heart beats. And it beats for everybody that has one. And it can go bad. And this is what I say to them as well. I showed them the flyer. I'm hoping that some of them may have joined via Facebook so they could hear what you all had to say as well. So with that being said, kudos to all of you. And if you hadn't been told today anything good, I'm going to tell you something now. I love you better than the next person. Thank you.
Thank you. We love you too, Miss Glover. Thank you so much for sharing those remarks about the NAACP Columbia branch. I was listening. Vivian, we're done. We're gonna wrap it up. Thank you, Harvey, for inviting me to moderate this awesome panel. I think Harvey called me because, like, Macy, you like to talk, and I'm just like, okay. But I learned so much too. And to Miss Glover's point, the things that we do or don't do at a younger age really sets us up, and shows us what we're going to be when we get older and what we're going to look like and what type of issues we're going to have based on our actions and our behavior, as younger folks. So I appreciate you drilling that into their heads. So I know that you all have an upcoming education forum on COVID-19 and the African American community, right, Mr. Beach? I think that's going to be next month, March.
The 9th.
It's going to be March the 9th here on Facebook Live and also on Zoom. You'll have other great expert panelists to give you realistic information. We give it to you straight, no chaser. We ain't got time for that, because we need for you to be able to utilize the information, do something with it, and impact change immediately. Right. Thank you all again for having me moderate this panel. Vivian, I'm gonna turn it over to you, dear.
Well, thank you so much, Mason. Thank you all for coming. Thank you, Facebook family, for participating and coming. And I want to piggyback off of what President Glover was saying. Hopefully, this will show you what the NAACP is truly about, because we're more than about just marching and picketing. We're about educating and advocating for our people, because if we don't do it, nobody else will. I want to take the time. Thank you, panelists, Ms. Cheryl, Chef Jay. Y'all were awesome. I learned so much, and I'm so excited about everything that I'm going to put into play in my own personal life, because I'm trying. I go to the doctor next week, so I'm excited to tell her all the things that I've learned, and then I'm going to put into play into my life. And I want to give a special shout out to my fellow committee members, Miss Tina Thompson, Miss Tina, Miss Wanda Lucky, Mr. Harvey, was always cracking the whip and coming up with the ideas and pushing us to do better and get everything out there to educate our community and educate our people. So I'm going to say what my pastor always says at the end of our church services. I'm excited about your future. I hope you learn something, go forward, teach, and pass it on. I love you all, and thank y'all so much for coming. Bye.
Amen.